Okay, everyone. Well, thank you. Thank you for the introduction. So my name is David Kaeli. I'm a professor at Northeastern University in the Department of Electrical and Computer Engineering. I've been working on this project for about 8 years now. And this has been a partnership across 6 universities and with our partner EarthSoft, which has been great. This is work looking at environmental containment threats and their impact on preterm birth. That's human births that that occur earlier than they should, leading to all different types of concerns, particularly birth defects and just other health-related issues. So with that, I'll jump into our presentation for today. So before I begin, I'd just like to acknowledge all the group of people that really have been making this work for a number of years, including our PI, Akram Al-Shawabka, but a number of PhDs, doctors, really a committed group of individuals that have worked on this many years and have been extremely committed to serving this underserved community. So a little bit about the project that I'm going to talk about. This is an NIEHS Superfund Research Program, P42 Center, that started in 2010. We basically are in where we are in our project now. We're expecting to complete 1,800 studies with expectant mothers. So we're actually tracking them through their pregnancies and actually after as well, and their children. So we have right now about 1,500 participants in our study cohort, and per participant we have approximately 3,000 data points. We do have a follow-on project called EQuIS that tracks the children's health, and I didn't mention it here, but I will later. We also are working with the environmental health children's study named ECHO that NIH is running. We're one of the cores there providing the data out of Protect. So looking more across multiple programs and projects in terms of environmental contaminants and their impact on children's health. So our key research questions is, is the contamination of environmental contaminants the contribution? What is their contribution to preterm birth? The preterm birth rate in Puerto Rico is significantly higher, or has been, and we're trying to understand that. And can we develop better strategies for both detection as well as green remediation to minimize or prevent these exposures to these contaminants? We do believe that we will have significant impact on the exposure and on the rate of preterm birth. We're also working on new technologies for discovery, transport, and exposure characterization, as well as for green remediation. And this is in a karst system, so it has its own challenges in terms of just the environment. But really, we're trying to improve environmental public health in the area in terms of practice, policy, and awareness around our theme. And I think we're being highly successful in that. So here's how our center is set up. I've presented some of this in earlier office hours, but just enough to give you a context. So basically, we're organized presently around 5 projects that do everything from targeted epidemiology, mechanistic studies, non-targeted chemicals, fate and transport understanding, and then green remediation. And then we have a number of cores. And so basically we're going across all of these different, these are all sources of data that come into human subjects and sampling that then come up to me, and I sit in the data management and modeling core that basically has to bring in all the clean data, manage it, process it, and provide it to the projects as well as across the whole center. So it's a highly labor-intensive process. We just came out of a meeting earlier today. Every Thursday we have a weekly data meeting that basically we review where we are in the data campaign in terms of, recruiting mothers and accessing whether it's environmental data, urine data, placental data. And again, it's just an ongoing process, and it's a great group of people to work with. Here's our study area, and this is a particularly relevant. Northern Puerto Rico has been an area that has had a large number of Superfund sites. Here we, in this graphic, we're showing the study area is in sort of gray tone, where, and then we're doing groundwater study on a subset of that where there's higher density of some of our participants. I also want to point out the approximate path of Hurricane Maria is the dotted red line, very dramatic here in terms of the community that we're trying to serve here, and some of the lessons we're trying to share with them, trying to understand. So this, while we already have a high degree of potential sites and Superfund sites in terms of pollution, where we also have the impact of the hurricane as well. So so our challenge is we're managing data across a multi-university distributed partnership. So 6 research active universities. We have some very diverse data cleaning requirements. So a lot of our data is collected in Spanish and then translated to English. A lot of it involves medical records. Some of it is environmental data, water samples. We send things to the CDC and get reports on things like phthalates. A lot of different studies that we're doing. We have different cores at different universities that are providing data, and all that data has to come to us. So that includes a wide range of data and privacy concerns. And so we really need to have the ability to work with a diverse group of individuals. We're dealing with environmental engineers, scientists, statisticians, pediatricians, hydrologists, and social scientists. So really a diverse group. So that gives you a little background on the Protect Center. Let me go into the design of our data and how we actually manage this data, particularly as it relates to using EQuIS. So basically our job is to provide secure and reliable storage and access to all the data that's generated and utilized in the center. We used for data import, we use Dropbox Professional. This has built-in encryption that we're using for remote data transfer when we manage that very closely and follow best practices. We use in some of the data for human subject data, we're using REDCap, which is a common collection, cleaning, export facility for collecting data, generating data dictionaries. We're using, in addition to REDCap, for all data in the center, EQuIS's electronic data processing, EDP, for data cleaning. And also we leverage professional and enterprise for a variety of data management tasks. And I'll describe some of those. So one of the key things about our design is we do data harmonization and analysis across the whole center. So we can take the environmental data based on a location with GIS, and we can take a placental sample that's from a mother that just delivered, and we can basically do an analysis across that environmental data and all the mothers that delivered and their placental samples, and look for any correlations, any indications of impact from the environmental assessment on the placenta. So again, we index every data item. So these 3,000 per subject with a subject ID, time of day, and/or a location, a GIS location. This really allows us to have a very rich data schema. Our whole center has a complete online data dictionary that's public. We do data exports and analysis using Enterprise. Again, we build our customized tools for doing data inventory, analytics, and mining that actually tie nicely into the back end of enterprise, and we'll talk a little bit about that later in the talk. Here's our data. As you can see, it's organized around projects. This is a slightly different cut at the projects because we've evolved the center, and so some of the the non-targeted analysis that we have done in the past, we've completed that project, but as you can see, for the human subject, for the expectant mother, we really are looking at everything from demographics, the water associated with within their municipality, or the tap water samples in the house, blood, so what's getting into the blood, what's getting into the urine stream, and we're looking for things like metals and phthalates and all different types of materials. And again, so we have a real challenge given this range of data that we're looking at. So right now we have 33 total fields per participant. So we have 18 different forms. When we talk about a form, that's an export to our database. So that's an import to our database from an export from somewhere else. And that number is growing. We're just starting a whole bunch of new forms from our targeted analysis. So we have basically, just on the human subject, about 4 million records. Our environmental data, we have wells and springs, field data, tap water samples. Our biological data, so we look at blood, urine, and sample. So 19 different phthalates and phenols, 18 trace metals, pesticides, and then we look at inflammation and oxidative stress analytes. We're also, for our non-target analysis, so based on mass spec analysis, we have, just for a small number of samples, 6 urine samples, we have over 1 billion data points. So this quickly explodes in terms of our analysis. Well, we've actually developed customized tools that for the analysis of these large non-targeted data sets. So here's the distribution of the women that are participating. So this is 1752 that were screened in 19 municipalities, and you can see their density. They're over our study region. And again, here is our questionnaire medical form information, how many have completed each one of these forms. Here's all the forms that we actually work with. So, and again, as you can see, so we have recruitment, then we have 3 visits. This is nurses going out to the home, or it may be in the clinic. And then there's birth and postpartum, and we're with follow-up. And again, trying to understand all the ties and causes if in instances of prematurity. So overall, we have a nice mix of environmental, biological, and human subject data. And again, we have a lot of tools for tracking our progress, for analyzing reasons why we're incomplete. Sometimes it's valid for fields to be missing, but we have done a lot of work to understand our data and make sure, 1, that it's clean, 2, that it's correct. So clean and correct are 2 different things. One is a quality study, and the other is basically whether there was an error that was made somewhere. So and we have multiple ways for doing that. So in terms of the database, which I think a lot of people here on the call are interested on, is we're basically adopted EQuIS as our their environmental data management software. We needed to extend the data schema, so we worked with EarthSoft and came up with a customizable schema that really enabled us to take what they had already developed around their sort of their concept of a test site, and bring this into what where we would study human subjects, environmental, biological toxicity in urine. And so we basically have built a very rich environment for doing this. So we do data cleaning with EQuiS. We have web-based dashboards and to support our distributed collaborators. We're using probably, this is maybe a little dated, but these are the actual versions that we're using of both EQuiS Enterprise and SQL Server. Again, the stability is more important than having the latest and greatest. We're quite happy with what we have to date. So basically, we have all these facilities. Again, going around the EQuiS model, we basically provide a web server for import and exporting data, and then we can provide it out to the projects. So, so our data sources are varied. We have information on water, basically demographics, you name it. It comes into our system. We go through EDP to actually do cleaning. From that clean data, we can generate any type of analysis that we want using common tools like ArcGIS. You saw some examples already, MATLAB or SAS. Again, we had to develop our own custom schema for this, so we really worked hard on that, and it's actually been quite resilient to change, so that's been great. Then we can export using EasyView and other tools. And again, we're not putting EarthSoft or EQuIS through its paces at all. I think we're using some of the more basic tools, but we've been able to meet the needs of a broad community, our researchers, obviously, but for education and training, and as well as community engagement. So, and we've been able to really be a service to the overall community. So in terms of our workflow, we start with a data dictionary. Data dictionary is key for us. Basically, we define every field, its data type. We may have some extra information about that particular data field, the units and the range. So if it has a valid range, we then build an XML schema that basically maps fields to database objects. And then using Visual Basic, we do a data cleaning for a complex set of rules for looking for dependent data that should be in a record. At the SQL level, through our schema, we're actually we do another level of screening, and where and we make sure our queries are working correctly, and we can do regression on that. And then our enterprise dashboards allow us to to generate customized SQL queries that can provide web-based reports. So, so we're using Enterprise to actually provide those customized dashboards, and that, again, that is used for a particular project, may have a particular result that they're looking for on an ongoing basis. We also have the ability to export on the back end of our system to many export data formats. Recently, we've been tying this and integrating it to data mining and machine learning tools, and we'll talk a little bit about that. But we're also working with exports that support community engagement and education. We really want to make sure the community here learns about their data, learns about what results that we're finding, what trends, not to necessarily, we want them to be more educated in understanding the connection between what they are putting in their bodies and how it impacts their lives, their health, and their children's health. So here's some examples of the dashboards. We have 21 widgets right now available in terms of presenting visual data. So we'd use this for both our users as well as ourselves in terms of we can do it for data reporting or looking at completeness. And again, lots of different capability here in terms of data visualization. So let me pause for a second and just say, we have a very well-functioning system. We've had it in place for quite a few years now. EarthSoft's always been there when we needed any help with. We really haven't run into problems at the beginning. We really needed to work across the schema and open that up. And they worked with us and helped us develop a very nice set of tools. So now we've taken this framework and we're starting to do data analysis. We're dealing with a lot of data that has high dimensionality. So if you take for just, let's take a couple of the forms that we work with. So this is the mother comes in and there's 240 attributes during the first visit that are collected and 800 during the second visit. And given the nature of the data, this is collected by the nurses. The data fields can be either undefined or set to their default values. And so we have mixed sparsity, and for the second visit, there's a very high percentage. And so we had a lot of missing data, and we had to figure out how, if we're going to be able to do any analysis on this. And again, most of the time, any data that's missing should be missing. It just doesn't, it's unrelated, but we need a way to understand this. Also, in terms of the data that we have, we're looking for the causes of preterm birth. The percentage of preterm birth is fairly small. So we have approximately 10 times the number of term births to the number of preterm. So we have an unbalanced data set. Many of the techniques that you would use in analytics or machine learning would overfit on that data. And so you have to be very careful how you use the analytics. Otherwise, you'll come to some false conclusions. And then we have diverse data types. So, everything from how long, the mothers are working, how many hours, their gestational age of where they are in their pregnancy, their race, their job type. So we have both numerical and categorical. So really a challenge in terms of the data. Well, we've built a tool chain that ties into our database. So, the green here basically is our SQL database engine that's interfacing to EQuIS. And, we've already completed this data entry. And now we're building analysis tools that, and again, we have the ability of allowing others to interface to us to actually do visualization and data reporting. So we want to tie in our analytics tools to this whole framework. So what we've done is, part of the challenge is we need to do online data filtering and dealing with missed data, or missing data. So we filter out text-based data entries and then filter out data that has less than 80% completion. We do this both sample-wise and feature-wise. Then we look at similarity-based missing data. And based on most common values, we can handle some of the missing values that are left, and we can fill those in. Then we merge that information, and we have now we can start to do some data analytics. So again, lots of different, we've tried a number of different techniques for, and in terms of this is what I refer to as data wrangling. Some people use different terms for that. We've done in terms of, we're trying to do correlation of the data. So we're using a number of different schemes, such as mutual information or the Hilbert-Schmidt independence criteria. Doing feature selection, we're looking at, we apply principal component analysis. And then we're looking at, for machine learning, some basic models of logistic regression and decision trees. Decision trees are particularly useful because they avoid overfitting for unbalanced data. In a related project to the P42 Center, I'm a co-PI on an NSF project where we built a visualization engine that actually is interfacing to the database. Basically, this is an open source project managed on GitHub. We have a bunch of undergraduates that have been working on this over the years. Basically, it builds a front-end web-based interface. And honestly, what we try to do is be able to provide near real-time processing in a distributed fashion to do data visualization across a variety of data. One of the focuses of this particular project is the ability to take the same data and look at it through different lenses from different perspectives. This is we refer to this as alternative clustering. So basically looking at other clustering approaches for the same data. So imagine, I always use the example of looking at the positive and a negative of a picture. Many people don't know what that means because they don't take pictures anymore as they did before with a negative. But basically you're seeing what's missing in the picture. You're taking it from a different perspective. And here, just as an example, there are 4 different versions of the same data being clustered in different ways. So we also on the back end, we build in and use most efficient computation, both from a library implementation as well as with hardware acceleration using graphics processors. So we call our engine NICE. It's the Northeastern Interactive Clustering Engine. And again, we can take a lot of different, we have a lot of capability in the back end. In the front end is just visualization. The user inputs a query on a data set that they're looking at, and our front end is Python, C++ based. And so we basically go between a C++ environment and a Python front end to get us to visualize data. And then we can do supporting, so far we have regression analysis, both linear and logistic, as well as 3 different clustering algorithms. KDAC is our kernel dimension alternative clustering, which again gives us multiple views of the same data. So here's some examples of the data that we've been able to characterize. Understanding what the participants' eating habits are. We can look at a simple dendrogram, looking at and how they're clustered. So you can see that in terms of the study IDs, they do cluster around, so this is sort of their distance between them. And you can see that there are subgroups, and depending on what granularity you want to analyze this at, you can see what foods they're eating or what liquids they're drinking, and again, see how this is impacting their health. We've looked at CVOCs in terms of their existence, and so we basically look at their proportion in water, and we can do this across the study area. And then we also look at the percent preterm birth. So we can basically look in one graphic, and we can superimpose this as well. These are just 2 layers, just showing you the capability of how the different concentrations are mapping to and these are localities within our study region. So again, some really rich mapping here going on. So in terms of our work, we've been quite successful in terms of being able to bring together the human subject, environmental, water, urine, placental, newborn data. We have increased the volume of data in the database by 10x in the past year. We expect that to continue to grow. We have developed these customized widgets through EQuiS Enterprise that really gives us, for our users, very quick ways to see their status, how things are progressing. We also use this to provide information about completion of different data sets in our system. The big data grant from NSF has also allowed us to do things with data wrangling and visualization and introduce new analytics. And we're looking how that can be portable over to the NIH project. We're also continue to add new third-party interfaces, and that's an ongoing work. And again, we're incorporating the data that we've collected to support other studies such as CRACE and ECHO that are also funded studies from NIEHS and NIH. So in terms of, this is, we have recently submitted I think it's our third renewal for our center to NIEHS. We've made significant progress. We've been very successful. We were one of the first centers that required, that built in data management as a core. And when I give talks at NIEHS, they're always really fascinated that we actually take this so seriously. What generally happens is each of the projects generate their own data, but they never go across those projects to understand. So they know that there's something in the water. They know that there's premature birth, but they have no way of harmonizing that data. The tools from Earthsoft with EQuIS have allowed us to build a system that actually allows us to do this type of data discovery and understand the factors tied to preterm birth. So, we're very thankful for Earthsoft for being a great partner. As always, we like to recognize those that support us, particularly Earthsoft, but obviously NIEHS and the Superfund research program. And with that, I'm going to end my talk and see if you have any questions.
Thank you so much. I will check and see if we have any questions. We do have one from Mary. She's asking, she says she may have missed a detail. Is Python running directly against EQuIS or SQL?
So the Python in our system, we're running basically on exports, not within EQuIS itself. So we're the only real processing that we're doing within EQuIS is we're doing C# on data import.
Okay. I have a question related to the actual data that you have been collecting. I'm curious if you've seen any correlations appear related to Hurricane Maria.
Well, because most of our data was collected before Maria, we are seeing differences obviously in water data, and we have projects that are looking specifically at that. But it's too early to actually have anything conclusive. As part of our renewal, we're actually looking at trying to understand how severe weather, such as a hurricane, does have impact on the water supply, and in that particular area, because of its nature with its karst environment, as well as having a large concentration of Superfund sites, it really does sort of put a whammy on the impact of pollution. So yeah. Again, this is as we go into more severe weather in our world, environmental health is going to continue to grow in importance. So.
Absolutely. And I remember the last time that you talked to us, Zika had just become a concern in the area. Have you seen correlated data related to that as well? Or is that not something you're necessarily tracking?
Well, we actually have a complete study on Zika as part of this as well. I didn't talk about that because I don't manage that data. That's a separate study. It was a very targeted study just for tracking the potential for Zika. So, but what's nice is once we've collected a lot of this data, we have blood samples, we understand the population, so we can actually track this, and we can, what's most important here is we're able to report back to the community, so they become more well-informed on the potential health threats that exist. We don't want to cause hysteria. We want to cause informed individuals that can make smart decisions. So we're really trying to work with the community very closely. We have great partners down there. And the team of nurses that's working with us in Puerto Rico is outstanding.
That's great. We have another comment from Ping. Great talk, Dave. Thanks for sharing, and is asking if the PowerPoint would be available later on.
Sure. Yes, we can share this.
All right, I will be in touch with you to get that.
Yep.
I don't see any other questions. I'll wait a couple of beats to see if anybody is furiously typing and check to see if anybody has their hand up. It doesn't look like it. I really want to thank you so much, Dave, for presenting today. This has been really, really exciting to see, and I'm glad to see that EQuIS has been expanded upon beyond what the original design to do such really important work. So thank you so much for sharing that.
And I just want to comment. I mean, I know that there's more capability within EQuIS that we're not using yet. I think we're so focused on trying to answer some of the science questions that going off and putting EQuIS through its full paces is probably something we need to do, and hopefully in the renewal we'll have more of an opportunity to do that. But in this world, sometimes we're more focused on getting today's questions answered, and that's really what our focus has been. So I just want to say that I know through my discussions with the EarthSoft team, there are more capabilities that we could use, and so that's what we look forward to using in the future.
Absolutely. The team and I have been chatting as you were presenting, saying, "Oh man, this would be so helpful if he upgraded." So
Yes.
hopeful that the renewal goes well, so that you can include that in your projects in the future.
Great.
So,
yep.
Thank you so much. And it looks like we don't have any other questions, so I'll do the regular out for those of you who are used to general attendance of the office hours. And we really appreciate you, Dave, taking the time to share an update about the project. And if you have any future office hour topic suggestions you'd like to see, please let us know. As always, you can reach out to us at officehours@earthsoft.com. And I want to note we've got a couple more thank yous coming in, David. So thank you so much. And thank you all for your attention. I hope you have a wonderful rest of your day.
Okay, thank you.